Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, the topic of discussion is attempts at unraveling fibroid. Fibroid is a uterine tumor, and you see ladies, some may have it of childbearing age, and they do not have a protruded tummy, and it might be even be a serious bleeding, menstrual bleeding. And some, you see, they have protruded tummy, but they don't even have it. And some may even have fibroid that is of a very big size, yet it's not seriously creating a problem. It's asymptomatic, that it's not really creating menstrual pains and all associated problems with fibroid. But fibroid being more common in black women, that's why it is serious, and the stigma of having fibroid. The stigma is really worrisome. You can imagine a woman seen as being pregnant, and after 9 months nothing happens. They start labeling her that she carries a fake pregnancy, and she cannot even be pregnant, and that's anybody. But we just want to know what could be the cause. So many suggestions like hormones have been proposed, that the estrogen level, once that production of estrogen starts getting high and what have you, this could result in fibroid. Fibroid may be there without being noticed, and at times it could also bring out this menstrual blood, come out with menstrual pain, but not really inconveniencing the person. But at times it could even be the cause of infertility, more or less, not allowing pregnancy to really get to full term. So we need to really study what fibroid is. Yeah, from the first picture to the left, you can see a picture of the uterus, the womb, where the baby is expected to be. But what do you find there? Labeled as submucosal fibroid is the fibroid attached to the wall of the uterus, and you now find it competing with the baby, the fetus, if it's so big, and it could even cause menstrual pain. Then you look at the second one as intramural. That one stays within the muscles, and the third one is subserosal. The causes, exact causes are unknown, but there are some factors that influence the formation of fibroids. Hormones, estrogen and progesterone are the hormones produced by the ovaries. They cause the uterine lining to be generated during each menstrual cycle and may stimulate the growth of fibroid. And like I earlier mentioned, it has even been discovered that you have high values of estrogen in the samples of women with fibroid. So that area is also of concern. Then there is the family history. We find out that people who have their parents or relation having fibroid, they usually have, and the pregnancy too, just as is expected, that there will be high increase. And women are at greater risk for developing fibroid if they are obese, having family history. There is a strong genetic mutation point that has been discovered, and which is as listed. There is also an additional study by Zink 2015 found an association between chromosome 1 and fibroid in black women. These are ongoing studies, and it has also been found that people with high BMI, fat people, overweight, have low vitamin D. So inflammation is also another source, endometriosis. And women who exercise and have low BMI have been found to have low experience of fibroid. We could also think of the microbiome of the uterus as being the cause. That's one of the latest findings. The microbiome has been the cause of fibroids. Microbiome is like talking of the ecology of microbes in a person. Lactobacilli occupies certain area and make it very difficult for pathogens to come in. So it protects that area. And it has been found that changes in the diet that we eat increase the availability of certain nutrients, influence and which bacteria dominates and contribute to the dynamic nature of the microbe. Also, finally, a few ways by which the gut microbiota contributes to uterine fibroid include estrogen, impaired immune function, inflammation, and altered gut metabolite. All these are earlier mentioned as being ascribed as cause. So you can understand when we talk of microbiome probably being now the latest focus. Therefore, in the future, while treating fibroid patients, various strategies to deal with changes in the gut flora may be advantageous. For better clinical diagnosis and therapy, the future is to further scrutinize the relationship between uterine fibroids and the gut microbiota. Read more, watch more videos on my channels.